Hi, I'm Dr. Ann Hester, but just think of me as Ann. I'm the author of Patient Empowerment 101, more than a book, it's an adventure. I'm a syndicated columnist, podcast host, and a few other things. But again, just think of me as Ann, just like I'm your neighbor. Now, women think differently than men. That's no surprise. But did you know that we deal with gender inequalities in America and around the world, and women do not get the same quality health care that men get? This is not about economics, it's about gender. In this webinar, I'm going to teach you how to prevent, treat, and possibly reverse some of the most common diseases. I'm also a health coach. And if you'd like to work with me, either one-on-one or in one of my group coaching programs, you deserve the very best. Some of my goals in coaching will be to shatter that inner glass ceiling that prevents you from realizing what your potential is, and then helping you map out a strategy to reach your new potential. I will share with you cutting-edge medical information and deliver it in a very user-friendly, simple format. Science made simple. Gender inequality is worldwide. It doesn't matter how much money you have. Take every step possible to empower yourself. Do whatever it takes to minimize the chance that you become an unnecessary statistic. Gender bias is fueling a global health crisis affecting women worldwide. From coast to coast and continent to continent, gender bias is real, whether overt or covert. In America, a study conducted in 2019 found that a significant number of women feel that the healthcare system does not adequately cater to their needs, and gender bias is a contributing factor. More than half of the female participants expressed concerns that gender discrimination adversely affects the quality of their medical care. And women are notably more inclined than men to express difficulties in validating the seriousness of their symptoms and levels of pain, with the gender gap widening further, particularly for women belonging to ethnic minorities. Research shows that women often have to wait longer and work harder to get a medical diagnosis. For example, women are usually diagnosed with cancer 2.5 years later, and diabetes 4.5 years later than men. This happens in more than 700 diseases, according to this study. And diseases predominantly affecting males tend to receive excessive funding, while those affecting women are often underfunded. Even though cardiovascular disease is the leading cause of death among women in the United States, only 1/3 of clinical trial participants are female. And the problem is not just in America. 24,000 Canadian women die of heart disease every year, according to the Canadian Women's Heart Health Center at the University of Ottawa. To put that in perspective, nearly 5 times more women die from heart disease than from breast cancer. But experts say heart health is still largely a man's world, as women remain underdiagnosed, undertreated, and unaware. In Denmark, a study analyzed hospital admissions from close to 7 million people during a 21-year period. 48.2% were women. In most cases, women were, on average, diagnosed at an older age than men. Researchers identified 963 diagnoses where the age at initial diagnosis showed statistical significance when comparing between men and women. According to the World Health Organization, gender inequality and discrimination faced by women and girls puts their health and well-being at risk. Women and girls often face greater barriers than men and boys to accessing health information and services. And these barriers include restrictions on mobility, lack of access to decision-making power, lower literacy rate, discriminatory attitudes of communities and healthcare providers, and lack of training and awareness amongst healthcare providers and health systems of the specific needs and challenges of women and girls. Our physical size does not reflect our inner strengths and amazing abilities. We can and do accomplish great things. But most women never truly step into their potential for greatness. In the whirlwind of life, we're often the unsung heroes juggling work, family, and caregiving with finesse. Our work never ends. We work just as hard as men outside the home, and sometimes have to work twice as hard to receive half the credit. And when we get home, we immediately start our second shift. But in this grand act, we forget the leading lady, ourselves. We're the ultimate multitaskers. But do we truly prioritize our own well-being? Isn't it time we step into the superpower of womanhood and refuse to settle for less than our true potential for greatness? As the years dance by, the likelihood of illness looms ever closer, like a relentless truck on the horizon. We catch glimpses of it, yet we push aside the urgency, believing we have time to sidestep it. But as the days turn into weeks and weeks into years, the truck inches closer until it smacks us in the face, right when we think we're at the peak of our game. And in that moment, it's not just a diagnosis, it's a stark reminder of missed opportunities. Let's rewrite this script. Let's seize the spotlight and take charge of our health before the final act begins. Act now. Stand firm for your health, vitality, and longevity before you're diagnosed with 1, 2, or even 3 potentially preventable diseases. Don't wait. And if you've already been diagnosed with chronic diseases, don't lose hope. There's much you can do. It's a lot easier to fight from a position of power and determination than from a position of despair and defeat. So we all have a roadmap of what we think our dream life should look like. So we finish high school, get a job, go to college, go to trade school, start a family, buy a home, and hopefully retire early and enjoy a long life with our loved ones. But the actual roadmap for many is very different. A lot of women are diagnosed with potentially preventable conditions early in life, spend a lot of money on medical bills, and can't afford the nice home, and retire early in a financial bind. But there are regions in the world where people often live to the age of 100 or beyond. So what are they doing? Many people are enjoying life at a ripe old age while others are in a nursing home. Now we're going to talk about specific things you can do to promote health and longevity. A healthy diet is extremely important. There are so many options we have, but we have to learn to choose wisely. Healthy food swaps can have a profound impact on our health and well-being. Yes, we're all tempted from time to time, and that's okay. That's normal. But this week, commit to making one healthy food swap, and next week, make another, and another, and another, and in no time, you will have transformed your diet. This isn't to say you can never enjoy your favorite foods. Just make sure the lion's share of your food choices promote health. We're all human, and sometimes we're going to choose a healthy snack. So get creative and start thinking of ways to incorporate healthier choices into life. And don't beat yourself up if every now and then you just want to splurge and enjoy yourself. But there is a dark side of a lot of types of delicious food. And just remember to make unhealthy food the exception and not the rule. It's worth noting, some food scientists are tasked with creating foods with just the right combination of fat, sugars, salt and a variety of chemicals to appeal to our senses. And when you eat those foods, messages are sent to the pleasure center of the brain, that same pleasure center that's stimulated with opiates, sex, and other pleasurable activities such as listening to your favorite music. Your body loves that sensation, so you crave more and more of this ultra-processed food. Meanwhile, your blood pressure may be rising, your arteries may be becoming clogged, and your favorite skirt just might not fit like it used to. Meanwhile, manufacturers are seeing their stock and bank accounts skyrocket, while our longevity plummets. Their net worth improves. We've got to break that cycle. Now, for the average person, a plant-based whole food diet can completely turn the tide on health. I'm not saying you can't eat meat, but when you do, make it something like a chicken breast or a salmon fillet. Some people will have dietary restrictions and recommendations, so it's always best to check with your doctor before making any major changes in your lifestyle, especially if you already have been diagnosed with a chronic condition like diabetes or high blood pressure. So you choose. Do you want man's food or God's food? Keep it moving with exercise. National guidelines recommend that people who are able should participate in 150 minutes per week of moderate intensity aerobic exercise, 75 minutes per week of vigorous intensity aerobic exercise, or a combination of both. So moderate intensity aerobic exercise is like walking at 3 miles an hour. You can talk a little bit to your friend on a brisk walk, but not a great deal. Vigorous activity is something like running or playing tennis, and you're not going to try to carry on a conversation. It's also recommended that people incorporate strength training 2 to 3 days or more per week. So again, an example of vigorous activity is jogging or running. But if you work at home, you can still get in a tremendous amount of quality exercise with equipment such as an under-the-desk treadmill, a stationary bike, or elliptical. Of course, you don't want to go too fast because you don't want to hurt yourself. Strength training is also important and can take many forms. You can even exercise and stretch while sitting down. So no matter where you are, you can engage in activities that will increase your heart rate and improve your cardiac fitness. Many people underestimate the potential of stress to destroy their physical as well as their emotional health. Have you ever felt this way? Commit to engaging in activities to reduce your stress on a regular basis. Exercise releases endorphins that make you feel better and help you sleep better. Some herbal teas are very relaxing, and nothing seems to beat a nice hot bath at the end of a stressful day. Some say laughter is the best medicine. Well, laughter releases endorphins, and that elevates your mood and makes you feel good. And deep breathing exercises are another popular way. Sleep is greatly underrated. Lack of restful sleep can, over time, decrease your life expectancy. Seriously. Here are some simple steps to optimize the quality of your sleep. Maintain a consistent sleep schedule. Create a relaxing bedtime routine. Exercise. That also helps you sleep better. Manage your stress. Stay active and limit naps, particularly before bedtime. But studies have shown that people who do take a nap during the daytime, such as a 30-minute nap around noontime, could have a larger brain volume as they grow older. Keep your room cool, dark, and quiet. Avoid caffeine close to bedtime. Do deep breathing exercises. Limit screen time near bedtime. You want to avoid toxins. If I told you every day a 747 is going to crash and kill everybody on board, would you book a flight on 747 anytime soon? Or each day more people die from smoking-related causes than would die if a 747 actually crashed. And alcohol intake has been linked to many health problems, including liver failure and heart failure. And even one drink per day can increase a woman's risk of developing. Go organic whenever you can. Some pesticides have been linked to obesity, diabetes, cancer, and other diseases. The Environmental Working Group website, ewg.org, is a goldmine of information about a wide variety of potential hazards associated with items we use every day. So grab your lotions, shampoos, detergents, and other household products and put them in the search engine to learn what potential hazards you and your family members are exposed to on a regular basis. And then you decide what you want to do differently, if anything. Social connections not only enhance our lives, they can actually prolong them as well. So remember, prioritize love. Anything else? Actually, yes. The healthcare landscape is not pretty now, and is predicted to get much worse. There is a worldwide shortage of healthcare providers, and the United States healthcare system is showing very concerning trends. The Centers for Medicare and Medicaid Services project that the average annual growth in national health expenditures will outpace the average annual growth in GDP for quite a few years to come. So that's a snapshot of healthcare in America, but how does America compare to other nations? America spends more per person on healthcare than any rich nation in the world. But you get what you pay for, right? No. The United States has the worst overall health outcomes of any high-income nation. Americans are more likely to die from avoidable causes and die younger. Americans have the lowest life expectancy at birth and the highest death rates for treatable or avoidable conditions. America has the highest rate of multiple chronic conditions and is the only high-income country that does not guarantee health coverage. It also has one of the lowest rates of hospital beds and practicing doctors per 1,000 population. This is particularly profound because we are also looking at what I call an impending medical tsunami. According to the American Association of Medical Colleges, America could face a shortfall of up to 124,000 physicians by 2034. And if you factor in the currently unmet needs of many in rural America and certain urban areas, that number could reach 180,400 doctors by 2034. So let's take a look at the people who died in 2019 and realize that the data lags behind the current year because it takes time to get the data together. So lower respiratory infections, over 3 million. chronic obstructive pulmonary disease such as emphysema and bronchitis, mainly related to tobacco, over 3 million, stroke, over 6 million, ischemic heart disease, and that just means the form of heart disease that leads to heart attacks or blockage of the arteries, almost 9 million. Now let's look at America in 2021. Diabetes claimed the lives of 103,294 people. Alzheimer's disease was profound. Chronic lower respiratory diseases, 142,342. Accidents, over 220,000. COVID, over 400,000. Cancer, over 600,000. And heart disease and stroke, over 858,000 people in 1 year. Now I'm putting up another screen. The screen shows in gray the diseases that we could profoundly impact. The good news, remember the PTR Reset: prevent, treat, and reverse disease. There are 6 pillars of lifestyle medicine that have been proven to promote longevity and vitality. Again, the PTR Reset: a whole food, plant-based diet, regular exercise, minimizing stress, getting restful sleep, avoiding toxins like tobacco, and having strong connectedness. Those 6 pillars can promote longevity and vitality. 90% of heart disease is preventable. 80% of strokes can be prevented. Over 44% of cancers can be prevented. And approximately 80% of chronic respiratory diseases are related to smoking. We can do something about that. Let's take a look at diabetes. Lifestyle changes can cut the risks of diabetes over 50%. The CDC's National Diabetes Prevention Program, which focuses on lifestyle interventions centered on promoting healthy eating habits and physical activity, can slash the risk of type 2 diabetes by over 50% among individuals at elevated risk. Diabetes can lead to blindness, heart attacks, amputations, strokes, dialysis, and severe pain, among other issues. According to the American Diabetes Association, in 2022, over $400 billion was spent related to diabetes. Over $306 billion was for direct medical costs, and over $106 billion was an indirect cost. So what do I mean by indirect costs? According to the American Diabetes Association, these include reduced employment due to disability, presenteeism, underproductiveness, and lost productivity due to premature deaths. That's profound. The website Statistica notes close to 10.5% of the global adult population had diabetes in 2021. And by the year 2045, this number is expected to rise to over 12%. If you have the same thinking, look for the same results. What do you expect? What do you want in life? And how do you start? You can do it yourself. I've given you some very important tools. You can do it yourself, or you could think about hiring a health coach. Now you may be asking yourself, do I really want to invest the time and money in a health coach? There are so many other things I want to do. Can I just Google it and find out how to make these changes on my own? But there's a very high cost of doing nothing. Let's take a look at getting a health coach. Now, this is according to Harvard Health. Coaching results in clinically relevant improvements in multiple biomarker risk factors, including systolic and diastolic blood pressure. That just refers to the top and bottom number of your blood pressure reading. Total cholesterol, LDL cholesterol, that's the bad cholesterol that blocks the vessels and leads to heart attacks and strokes. HDL cholesterol, which is the good cholesterol that helps clean out your vessels. Triglycerides are also important in vascular disease. Fasting glucose, which deals with the likelihood of diabetes, body weight, body mass index, waist circumference, and cardiorespiratory fitness in multiple populations. So a health coach can help identify hidden barriers to change and work with you to overcome these barriers. A coach can provide encouragement, support, and motivation, share cutting-edge information on lifestyle, dietary, and exercise recommendations, help you set goals and hold you accountable for reaching those goals, promote longevity and vitality, help you develop a roadmap for the rest of your life, and more. Are you ready to pivot and change your health trajectory for the rest of your life? Do you want to transform your life? I thrive on empowering people. When I was a third-year medical student, and a lot of my colleagues were out enjoying the weekend, we had time off, I was busy writing my first book, and I've been writing ever since. Never settle for less than you can be. It's time to shatter those inner glass ceilings and realize who you really can be. If you're looking for more energy, more vitality, decreased incidence of common diseases, and decreased incidence of unnecessary premature death, a health coach can be instrumental at helping you reach your goals and helping you set greater goals than you ever imagined. One patient that I will never forget is the patient who lost 99 pounds. I was always counseling this patient, and then the patient stopped coming, and I thought maybe I went too far. One day I opened the examining room door. Dr. Hester, I was trying to wait till I lost 100 pounds, but I lost 99. I had this bronchitis, and I had to come and see early. That's success. Everybody will not reach that level, but that just goes to show you what is possible in certain circumstances. How will you ever know if you're capable of climbing a mountain if you don't climb that first small hill? You know we don't think like men. We don't process things like men. And for the most part, women don't realize their true potential. That's something that we can change. I'm also a transformational health coach, and my methods are informed by women-centered coaching techniques. Yes, you could try to do it on your own, and some people are successful, but most people are not. They would benefit from the expertise of someone who can help them realize the real potential, not the potential that they once imagined. A high number of diseases that kill people can be prevented, treated, or even reversed. Seriously, that is true. Reach out to me for a complimentary discovery call to see if we're a great fit for each other. There are limited slots available for individual coaching. There are more slots available for group coaching. Whichever you prefer, reach out to me today.